David provided a lot of great information about signs and symptoms and definitions of the common illnesses that we experience. I now want to talk about, as a program leader, what is your actual role and what are the responsibilities if you're ever faced with this situation. So first off, stabilize the situation. Use the methods that David talked about, the decision-making filters that determine the stability of the situation. Is the student at harm to themselves or others, or are you capable of managing the situation yourself? You then want to secure the situation and the environment. Maybe you can separate the person, the student and participant, from the others in the group to ensure their privacy and the sensitivity of information. Maybe you're able to go for a walk or move to an empty area while remaining visible to others in the group. Remember, as a program leader, you don't want to be isolated and alone with the student, but you can be within eye shot and not earshot. Monitor the effect of the rest of the group. This means you want to make sure the other members of the group are not impacted, rumors don't start spreading, or cliques starting to be formed. So ensure the stability and the security of the student, but use this time to gather more information. And always, always, always keep these students supervised. Ensure the person is monitored. Do not allow them to go to a room by themselves. Do not allow them to take a walk by themselves or create an environment where they're not being monitored. And then escalate the information you have and the situation. So again, you've gathered your information. Now call for help because you are not alone. The first level is obviously calling your country management team, your program manager, your country manager, even your country director. And recognize that I'm available, as is David Baker and the entire risk and safety team. The operations team is available as well, and International SOS, our emergency medical and evacuation partner. And finally, we need to communicate. Once we formulate a plan, once we've escalated it to the appropriate person, we want to inform parents, maybe the school, and the participant as well. What I mean by that is, let's formulate a plan, let the participant know what we're going to do and how we're going to act on that plan so they are not surprised.
So Dave has talked about the escalation process when you're trying to determine how serious someone is about maybe committing suicide or self-harm for that matter. You're going to notice an escalation in the emotional tone around you. The student is going to be acting out, or they're going to be expressing things that can be really disturbing to them and to you. So the two things we want to look at next is, first, how do you step into that situation and be even more specific about determining what action to take, number one. Number two, determining your own capacity to stay in this with the student, because as the escalation rises, as the feelings and the emotions and the expression rises, you can begin to feel the panic within yourself. And you might have a difficult time managing that panic, and that's okay. There's no shame in that. It's just that we want you to make an accurate self-assessment to determine whether or not you need help or whether or not you can stay the course and stay with the student. It's okay to feel powerfully right along with the student. So we're not saying if you're feeling powerfully you shouldn't stay and try. It's that if the feelings are so overwhelming, if you're feeling flooded by those feelings and feeling like the feelings are making it impossible for you to stay clear intellectually, mentally, that's when we want you to wonder, maybe I need some help, or maybe I need to self-eliminate and get another person in to help me. So as we look at treatment steps, ask, can you manage this participant? Just ask yourself that. And don't be overconfident, don't be underconfident. Take, as much as you can, a pretty accurate inventory of your potential. Is there any danger to yourself, to the participant, or to others? We've already said, one of your first kind of discernments is how present is the immediate danger. Like, does this person have a weapon right now and they're going to do something? Or are they simply talking about it? So is there a danger right now or not? Calm yourself before calming the participant. You always want to try to, kind of recenter yourself, as they like to say, and you can do that by deep breathing. But deep breathing and taking deep breaths and kind of centering down into yourself is one of the most effective ways to stay calm. Seek a physical cause. Rule out or confirm other causes for changes in behavior or mental health concerns. Like, is there something around them? Did something happen? Like, we use the illustration of the student, the participant who was afraid of going on the rafting trip. Is there something coming up or that just happened on the program that was particularly traumatic? Try to figure out if there's something in the environment that's causing them to panic or to be wanting to hurt themselves. Inquire about history of mental health treatment, psychiatric history or related hospitalizations. We hit this all the time. You know, to ask a series of innocuous but direct questions about, like, okay, you know, how have you experienced this before? Have you experienced this before? How frequently? How intense were they? Are you on medication? Those kinds of things. Listen carefully. Offer them a calm voice, easy breathing, eye contact, and patience. Basically, be yourself. We wouldn't have hired you at Rustic if we felt like you were not capable of self-soothing, staying calm in a situation. We anticipate that you know how to do that. We need you to bring your best game to that moment. So mirror to them what you would want in a similar situation if you reversed roles and you were the one struggling. What kind of a presence would you want sitting before you? Who would you like that person to be? If you can be that person, game on. So being that person that you would like to have sitting in front of you, if you were the one who were struggling, there's a couple steps that will help you be that person for that participant. Keep questions simple, honest, direct, respectful. You'll need to ask questions, but notice the demeanor. You may need to repeat questions if the participant has trouble tracking with you, which is fine. Just be patient. Take mental notes. You might want to take some written notes if you want, but that tends to distract also from being in the moment with the person. But that's really your call. Ask if they know what led to their symptoms as per the patient assessment sample history. There may be causes that you can get to. So again, we're asking for not just symptom dealing, where you're actually working with the patient to listen and care, but we're asking, you know, can we figure out why you got here, how you got here, what are the underlying causes? Ask if they are having thoughts that are producing fear, sadness, anxiety. We didn't go into a lot of detail on this, but virtually every mental health symptom, but let's just stick with anxiety and depression to make it easy. Most anxiety, most depression, most of those feelings are preceded by a thought. So you have the thought and then you have the feeling. And if you can understand what the thoughts are that the student, the participant is having that might have generated that symptom, you're doing a great work. So if they say, for example, you know, I was thinking of how I would much rather be back in my bedroom at home and sleeping in a warm bed rather than in this tent. And that made me think about being homesick, and it made me miss my cat or my dog or my brother or, you know, whatever. Well, you've isolated the thought that's caused the sadness, for example. So, you know, you might want to ask them, you know, what are you thinking that might be disturbing and might be causing you to feel bad? If they've had a similar symptom in the past, help them identify tools that may have helped. Ask if they can access those now. For example, some people with anxiety will say, you know, if I just remember to do some deep breathing exercises in the middle of that panic attack, or just as the anxiety or the panic attack is coming on, if I just remember to use that tool, that can help reduce or in fact sometimes even eliminate the anxiety or the panic attack altogether. So remind them that they have tools perhaps that they can call and draw on from their history. Demonstrate calm and reassure the participant. If you know, it's hard to be calm in a desperate situation. It just is. But knowing that your best gift to yourself and to the participant is to remain as steady state as you possibly can, that's always the best way forward.
A final topic of today is, at what point would we send a student home or encourage them to go home when a situation is too much for us to handle? Whenever the harm to the program outweighs the benefit to the participant is a good indicator. Second, when the mental health condition is beyond your ability to manage this in the field is another great indicator. Whenever the participant is a danger to themselves or others, whether this is a verbal thought of suicide or they actually demonstrate self-harm or perform any other unacceptable risk. And finally, if the participant or caregiver continues to believe that they are unsafe or unable to continue with the program, is when we will encourage a student to go home. Do not make this decision yourself. Always escalate to your management team, and we will come to the best decision as appropriate. Thanks for joining me today. I really appreciate David Baker's time. If you have any questions, please again reach out to any of us on the risk and safety team, within the operations team, or even David Baker himself. Thanks.